Hi, everybody. Dr. Daniel. Today I'm talking about Zavegepant for acute migraine treatment. Approximately 70% of persons with migraine have never had a diagnosis by a doctor or been prescribed prescription medication for migraine. This is tragic, since migraine occurs in 12% of the population and 25% of women and 5% of men. It's one of the most common disabling reasons to go to the emergency room. Nausea occurs in 90% of migraine patients, and 70% of them have vomiting and other common migraine symptoms such as one-sided, moderate to severe headache and sensitivity to light and sound. Xavikepent has been accepted as a new drug application for intranasal treatment of migraine. In other words, the drug is not approved yet. It may come out in 2023, but now it's an application. This is a nasal spray providing headache relief as soon as 15 minutes and lasting for 48 hours, which is pretty cool. That's 2 days headache-free there, or headache better. Zavegepant is a new Gpent type drug, specially useful for migraine patients who have nausea and vomiting with their attacks, like I've just listed, so many of them do, so they don't need to take an oral pill, which may make you nauseated and you don't want to swallow at that time for some folks. And also works faster than the other Gpent drugs that are oral pills. Zavegepant blocks the calcitonin gene-related peptide, Cgrp, which is thought to be the most inflammatory active chemical released by the migraine process. How does Zavegepant work? Migraine is a process in the brain wherein the trigeminal nerve, the ganglia of the trigeminal nerve, and the cerebral arteries release neurokinin A, substance P, and Cgrp. Zavegepant is a new, specifically acting drug working to block Cgrp release. How Cgrp is successful in migraine treatment has been found by the subcutaneous and IV use of preventive drugs like Aimovig and Ajovy for migraine. Zavegepant is a very soluble, small molecule Cgrp receptor agonist with analgesic and immunomodulating activity. After release, the drug binds to and inhibits the activity of Cgrp receptors on mast cells in the brain. Zavegepant inhibits neurogenic inflammation caused by trigeminal nerve release of Cgrp and blocks Cgrp receptors in smooth muscle cells within vessels, inhibiting dilatation of intracranial arteries. It also suppresses pain transmission by inhibiting the central relay of pain signals from the trigeminal nerve to the caudal trigeminal nucleus. So Xavikepent works in the migraine timing cycle, which is trigeminal activation 1, 2 neurochemical release, 3 meningeal vasodilatation, and 4 central pain transmission, inflammation of the thalamus, and it blocks the movement from 1 to 2. Would Zavegepant have a special place in acute therapy of migraine? Yes, as a nasal spray. It could be taken by migraine sufferers with nausea and vomiting who don't want to take an oral pill or inject something like sumatriptan subcutaneously. What are other currently approved Gpent drugs for migraine acute treatment? Other drugs are Nurtec ODP, Rimegepant, Ubrevely, Ubrogepant, and Qulipta Autogepant, which are oral drugs in the Gpent class. What are the other currently available nasal spray treatment drugs? These drugs are Migranol, dihydroergotamine, and Trudhesa, also dihydroergotamine, given as nasal drugs. What about development of medication overuse headache with Zavegepant? Gpents, like Zavegepant, have Cgrp blocking action, which has not been found to be associated with medication overuse headache, or the old term so-called rebound headache, a major problem with other acute migraine drugs such as the triptans. Triptan's development of medication overuse headache following repeat drug use increases the number of migraine attacks. A Gpent used for migraine, like Zavegepant, would not have this problem. What do important doctors think about Zavegepant? Well, Vlad Coric, MD, the Chief Executive and Chairman of Biogen, makes the following comment. They make the drug. Migraine patients want an acute treatment that provides fast, lasting relief from the debilitating symptoms of this disease. If approved, Zavegepant would provide a new treatment option for patients who need ultra-rapid relief in as early as 15 minutes, and for those experiencing nausea or vomiting and need a non-oral treatment option. We have generated robust data from 2 intranasal pivotal trials with this drug that were submitted, and we hope this brings out for patients who have migraine. The most bothersome symptoms were chosen from photophobia, phonophobia, or nausea. Higher rates of pain relief at 15 minutes, return to normal functioning at 30 minutes, and sustained pain relief at 24 and 48 hours were also significantly higher with Xavikepent versus placebo. Richard Lipton, professor and vice chair of the Department of Albert Einstein College of Medicine and director of the Montefiore Headache Center, commented, many patients with migraine need treatments other than pills for at least some of their attacks. Swallowing a pill may make nausea worse, and if the patient vomits, medication cannot be absorbed. Nasal sprays are a favored option to tablets in many situations. In addition, many patients dissatisfied with their current treatments want fast relief so they can get back to their plans without missing life's important moments. Zavegepant nasal spray will be an important option for patients taking non-oral therapies and fast relief. Though head-to-head studies are lacking relative to Striptin nasal sprays, Zavegepant should provide favorable safety and tolerability, lack of cardiovascular contraindications and precautions, and a reduced risk of medication overuse. Another doctor, L.C. Stock, MD, Chief Medical Officer of Biogen, commented, in addition to providing new treatment options for everyday heroes at home, work, and school, many of the 40 million people in the U.S. with migraine hold high-intensity jobs. When migraine strikes, they need a fast-acting treatment option that enables them to quickly get back to work and keep on working. The Xavikepent profile of ultra-rapid 15-minute onset and durable efficacy through 48 hours with a single dose is uniquely well suited to people with migraine. So it's the end of my comments on this new drug that's possibly will come back out next year. I hope you have learned something from it. God bless all you folks who have migraine. Please click on subscribe and like down there. I'll see you again on the next talk.